So, coming up to the next, these are just a few samples of different polypropylene meshes. You can see the weight of these meshes, and you can see that there's a direct correlation of the weight of the mesh in gram per square meter compared to the percentage of apoptotic cells, which is a marker of the inflammatory reaction. No wondering, but we have to keep in mind that lightweight is not always lightweight. There are some more textile characteristics, because this is a mesh which has 45 gram per square meter compared to this one, which is lighter. But having a look at these ultra-structural pictures, you can see that this is nearby a fleece, a kind of woven thing compared to this one, constructed out of larger monofilamentous with bigger pores. So we have to keep in mind that there is another factor, the pore size of these meshes. And this is a Merceline mesh, for example, inducing the foreign body reactions. You can see the inflammatory part, you can see the connective tissue part. And what we found out is that if the filaments of these mesh materials are lying directly next to each other, the connective tissue is bridging from one filament to the other, embedding the whole mesh sample into a huge scar plate compared to these large pore-sized meshes, which are encapsulated just by the single filament, leaving place for physiologic tissue ingrowth. And this is how it looked like in histological sections. You can see a large pore-sized mesh, connective tissue formation just surrounding each filament, leaving place for physiologic fatty tissue integration compared to this mesh, which is the same magnification, embedded totally in connective tissue, leading to what we call scar plate formation. And clinical picture considering these both kind of mesh materials, the lightweight, large pore-sized mesh compared to this stiff and bulky scar plate over there. So I already talked about the pore size. I already talked about the weight of the filament, the weight of the mesh, and another item is a kind of the filament. And this is a study done by my colleague Uwe Klinge, investigating the effect of multifilamentous meshes on the adhesion of bacteria. And what we found out is that next to an increased adherence of bacterials, there's the biocompatibility of a monofilamentous mesh is superior to a multifilamentous mesh. So overall, these optimized mesh materials should either be pure lightweight, large pore-sized, or the so-called partially absorbable. So what is it, the partially absorbable meshes? These are actually just lightweight meshes with an added absorbable part to help you to handle this mesh during the operation. And these Ultra Pro mesh, which I investigated within this experimental setting compared to the naked polypropylene part, had no significant effect on the inflammatory reaction and no significant effect on the connective tissue formation compared to the pure lightweight and large porous monofilamentous polypropylene mesh. So the supplementation of monocryl has no effect on the biocompatibility of this mesh. And there's another experimental study proving, it is not yet published, written, but proving this excellent biocompatibility of this supplemented lightweight mesh, which actually leaves the pure lightweight mesh after 2 or 3 months. And just have a look at 2 or 3 clinical studies. I think tomorrow we go on this in detail. There's just one study investigating the Ultra Pro mesh right now, the study by Khan et al. And he found that there was no significant difference in pain, but what he found was an improved, that the postoperative pain scores improved earlier in patients with a lightweight mesh compared to a heavyweight mesh. Another clinical study by Otvaya, which unfortunately found a higher recurrence rate using this lightweight mesh. This was not proved by a study from Brinkman, investigating again a standard mesh and a lightweight mesh. He couldn't find an effect on the recurrence rate, but he found an improved aspects of pain and discomfort even 3 years after surgery. So, and you already saw this review published within the American Journal of Surgery last year, and they tell us that we probably have to use these lightweight meshes within hernia surgery. So, coming back to the question you gave me, the influence of monocryl supplementation and the biocompatibility of a polypropylene mesh, does it impact groin pain? Probably not, because this mesh is a large pore-sized and a lightweight and an elastic mesh made of monofilamentous filaments, which in general shows a decreased rate of chronic pain after the operation. Thank you for your attention.